And when they had crossed over the lake, they came to a land at Gennesaret and moored the boat. When they got out of the boat, people at once recognized Jesus and rushed about that whole region and began to bring the sick on mats to wherever they heard he was. And wherever he went, into villages or cities or farms, they laid the sick in all the marketplaces and begged him that they might touch even the fringe of his cloak. And all who touched it were healed. This is the word of the Lord. Thanks be to God. In our gospel lesson today, Jesus' disciples are tired. They've just finished their first mission. They've come back after helping a lot of people. They've worked miracles in Jesus' name. And Jesus knows his disciples need to rest. They deserve to rest. But then Jesus sees masses of new people who need help. Jesus demands his disciples give up their well-deserved rest and keep working. In Eugene Peterson's translation of this story, Peterson translates it like this. He says, "At the sight of them, his heart broke. Jesus saw the needs of so many people, he could not bear to not help." And I believe most of us are like that. If we know someone is truly in need, we want to help. If we know we can do something to help, we have a hard time not doing it. And most of the time we know that when people work together like this, there are good results. Just like in today's reading from Mark. We know that God will supply our needs if we let God work through our lives. This reading tells us to continue Christ's work even when it's a challenge, and assures us that we will receive the blessings God promises. So as we turn to our modern world and look for the needs around us, one of the most challenging is our healthcare system. On the one hand, it's a very good system for people who have healthcare insurance, who educate themselves about how to care for their own health and how best to approach the healthcare system when they need it. When our system works, it's amazing. On the other hand, there are a lot of people who are not in the system. There are 5.8 million Texans without health care coverage. That's 25% of our population. This makes us the most uninsured state in the nation. There's around 1.5 million children in Texas who lack insurance. And 90% of these children have at least one working parent. The reason for that is the average cost of employer-sponsored family health insurance is about $1,000 per month. That's a lot of money for a working family. And just in case you're wondering, all these figures that I'm going to talk about in this sermon come from Texas Impact, which is a statewide religious grassroots network. And they have a very nice website, texasimpact.org, that kind of talks about the issues like healthcare that are facing people in Texas. So there are about 750,000 Texas children. Half of our uninsured youth are eligible for the CHIP program, the Children's Health Insurance Program, or Medicaid, but they're not in those programs. So half of our problem with our children is that the programs are there for them, but the families who need those programs either don't know about them or don't know how to get to them. So how do we fix this? The 5.8 million Texans without health coverage, 1.5 million children without health coverage. How do we achieve justice in our healthcare system? It's one of the big questions facing our nation today. As Americans, we have a number of options. We can let our legislators know our needs and our concerns. And the good news is that the Texas House of Representatives is working to address some of these problems right now, but they need the encouragement and support and involvement of the people of Texas to move them in the right direction. We can help families who qualify for the CHIP program to learn how to get their children covered. The funds are there for a lot of these programs. People simply need to know how to get into these opportunities for them. On the national level, we're in the middle of a giant debate about healthcare. And let me say before you get too worried, I have no intention of offering any answers this morning to this debate. But I do believe that the approach Jesus took today in this reading is very useful for us. No matter how much we've done in the past, no matter how tired we are of this issue, no matter how much we've given, no matter how unfair we think it is to ask us to give more, Jesus says, before you make any decisions, look around you. Can you see 5.8 million fellow Texans who just need something and say no to them? Can we look at these people and turn away? And Jesus is guessing we can't do that. Somehow those disciples 2,000 years ago found it in themselves to continue to help feed the hungry and cure the sick. And somehow the followers of Jesus today will do the same. Fortunately for me, the answers to our problems aren't going to come from this pulpit. They're going to come from people like you. Because we are blessed to be followers of Jesus and citizens of a nation in which our government will listen to us, the answers to our healthcare problems are going to come from people like us. So whatever your perspective is on this issue, your legislators need to know. All of us need to take the responsibility to not just think of ourselves, but to think of all the people we know, and to ask our government to do right by all the people. There's got to be a way to get health care to the people who need it. Another question we can ask is, where is the need so severe that any of us would be willingly pay a little bit more to see that need met? Where are there children who need vaccinations, who need basic emergency care and having a hard time getting it? In the next few months, these questions are going to be answered by somebody. I think the challenge of us Christians today is to look around us, learn about the real needs in our communities, and then make sure the people who are making these decisions hear from us. They really do need to hear from us as citizens, but beyond that, Christ is calling to us, saying this is a giant part of Christian ministry. This is going to affect millions of people. It's going to involve a lot of money. Have you thought about it from a perspective of faith, what this nation needs, and have you done anything about it? One more comment about the story from Mark. There's an earlier story in Mark's gospel in which Jesus goes to a certain town, but he's unable to do much for the people there at all. He heals a few people, Mark says, but most of the people don't even want to get near him. His amazing and divine powers don't work very well. It turns out that's his own hometown. And Mark says the reason people that Jesus really couldn't do much was because they remembered him as the carpenter, as the young man from their own community. They really didn't believe he could do anything worthwhile. And Mark says not only was Jesus amazed at their unbelief, but he was stripped powerless by their unbelief. He could not help them because they didn't believe they could be helped. Now in today's reading, the contrast is that the people believe so fervently that they believe if they just reach out and touch the edge of his cloak, they'll be healed. And it works. And so I think for Mark, the gospel writer, the question is this: what can we believe in? As followers of Jesus Christ, what can we really believe in? If we believe there is no possible way to get every family decent health care, then it's not going to happen. Period. But if somehow we get together as an American nation and believe we can do this, Mark says it can happen. Miracles can happen if we believe. God will supply our needs if we let God work in our lives. It's just one issue, but it's a big issue facing a lot of people. If you don't think it's a spiritual issue, wait until someone you know is sick and can't get help. And you'll see how quickly that becomes a spiritual crisis for them, their family, their friends. They begin questioning what faith means, what this nation means, when they cannot get basic help when they need it the most. Jesus says, don't turn your backs. But we need to think with our minds of faith, figure out what those answers are together, and let God work through us. If we continue to do Christ's good work of looking for the needs of the world and then answering those needs by our courageous actions, Mark assures us we will receive all of God's blessings.